Hello, I'm Bee Freedman, and I'm a volunteer educator for the Senior Medicare Patrol, the SMP. The SMP is part of CARIE, the Center for Advocacy for the Rights and Interests of the Elderly. The SMP is a national initiative grant-funded by the Administration for Community Living. The SMP program is dedicated to curbing fraud and abuse in Medicare and Medicaid. SMP volunteers usually go out to talk to meetings of senior groups about how to recognize and protect themselves against Medicare fraud and abuse. But right now, it's not safe for us to meet in person. So I want to give you this important information in a short video. I'm a senior myself, and I think this topic is super important to all of us. Medicare fraud and abuse is estimated to cost Medicare between $60 and $90 billion a year. And individual seniors lose an unknown but large amount of their own money from some of these scams. The SMP wants you to be safe from scams and fraud. While healthcare scams and frauds are always coming at us, the COVID-19 pandemic has given scammers a great many new opportunities to target and scam elders. What I want you to take away from this video is summarized in 3 words: protect, detect, report. First, protect your personal, financial, and medical information at all times. Second, detect scams by understanding how they come at us and what to do about that. Third, report scams to the government and to CARIE if you think you've become a victim and need help. Your first scam defense is to protect your personal, medical, and financial information at all times. Never share it with strangers. The personal information to protect includes your name, address, phone number, and even your email address. The medical information to protect is your health insurance ID number. All seniors have a Medicare ID number. Seniors who enroll in Medicare Advantage plans also have an insurance card with a plan ID number on it. The financial information to protect includes your bank account information, credit card information, and Social Security number. Never share this information with strangers. Getting you to reveal these facts and numbers is the goal of every Medicare scam, because with that information, thieves can bill Medicare for services not actually given to you. Your second scam defense is to detect that a scam is targeting you. Ideally, you want to do this before you fall for it by knowing what to watch out for and avoiding any trouble. Medicare scams use the most common communications channels in our lives. First, emails to your computer or your cell phone. Second, phone calls to your home phone or cell phone. Third, text messages to your cell phone. Fourth, social media solicitations, for example, ads or messages on Facebook or similar sites and accounts. Fifth, in-person contact. Strangers who knock on your door or who set up tables in public locations are never to be trusted. Many of these messages contain links to malicious websites. Sometimes you may even blunder into such a website just while searching for information online. These websites have ways to steal your information right off your computer or cell phone without you even knowing it. You can stop a scam attempt in its tracks by remembering that strangers have no legitimate reason to contact you out of the blue, and that you do not owe them any response. Remember, it is shrewd to be rude to such people. There are 4 protective and defensive actions you should always take. First, be cautious of all offers for free products or services that require you to reveal your personal medical and/or financial information to get them. If you need a product or service, look for it yourself from reliable sources. Second, never click on or reply to links in emails or text messages. It's just not a safe thing to do. Instead, delete all such messages immediately. Most of these links will steal your personal medical and/or financial information. Third, do not answer requests to verify your personal information in order to get something important. That word verify sounds so official, but it's a trap. If a legitimate government or financial agency needs to contact you about your personal medical or financial information, it will send you a paper letter on official letterhead and in an envelope that clearly shows it was mailed by that agency. Fourth, read your Medicare summary notice every quarter if you use traditional Medicare, or read your EOBs, your explanation of benefits, from your Advantage plan each time an EOB comes. You want to make sure you recognize everything on these reports as legitimate medical services you actually receive. You will likely encounter pressure tactics in messages like these that insist you act now. The only urgent thing you need to do is to keep yourself safe. Everything else can wait 10 minutes while you think twice about what some stranger is asking you to do. In that calming delay, you can decide it's likely not a good idea to do what a stranger is urging you to do. The COVID-19 pandemic has produced a new wave of scams to steal your money or your personal medical and financial information. What should you be alert to? There are 4 broad categories of COVID-19 scams. First, be alert to people selling fraudulent health products. Remember, there is currently no vaccine against this coronavirus, and the only drug with FDA approval is available only to hospitals for patients who are severely ill. Second, be alert to people selling essential supplies but not delivering them. Beware of messages and of offers to sell you food, paper products, masks, gloves, sanitizers, and so on. You might prefer to stay at home and order things for delivery, but unless you already know and trust the source of an offer, it's best to skip it. You will get charged for items that are never delivered, and even worse, the crooks get your name, address, and financial information. Third, be alert to people falsely claiming to represent government or health organizations whose names you know and trust. There are fake messages from the Social Security Administration, the Internal Revenue Service, Medicare, the Centers for Disease Control and Prevention, the National Institutes of Health, the World Health Organization, and similar well-known agencies that may arrive, asking for your personal, medical, and/or financial information in order to give you so-called important COVID-19 information, or some service or other thing of value, such as tests or cures for COVID-19. Please remember, legitimate agencies will never contact you by email or text message with requests for personal information. Fourth, be alert to fake nonprofit organizations asking for donations to help COVID-19 victims. Scammers are sending messages about helping people who need food or money due to the pandemic. It's natural to want to help, but actively choose a trustworthy charity for yourself by consulting people you trust to give you the names of real charities. Your third scam defense is to report suspicious messages, fraudulent offers, hoarding of supplies, or price gouging for supplies to CARIE and/or the federal government. Call CARIE at 1-800-356-3606. Call Medicare at 1-800-633-4227. Call the National Center for Disaster Fraud hotline at 1-866-720-5721. You can also contact local law enforcement. CARIE also has a COVID-19 section on our website, www.carie.org/resources/COVID-19 resources. You can also call the CARIE line at 1-800-356-3606 Monday through Friday, 9 a.m. to 5 p.m. if you think you've been scammed and need help from a trained staffer. You can also visit CARIE's website anytime at www.carie.org, where help is always free and confidential. Thanks for listening to this presentation today, and please be safe.